Hiya and welcome to Brain Injury Bites, where we provide help and advice for people after a brain injury. My name's Brooke and I've lived with a traumatic brain injury since 2007.
Hi, I'm Ashwini and I'm a trustee at Headway Warrington. I'm also a senior associate solicitor focusing on catastrophic injury, including brain injury. In this episode, we'll be talking more about the journey of being in hospital, how as an injured person, it felt like being in hospital, and also tips for friends and family members who might have a loved one in hospital after a brain injury. So looking first of all at the typical journey, we talked about when you had your accident, Brooke, and the sort of the scene at the time. It was absolute chaos. You had the ambulance and lots of people around. And then you were taken to A&E, is that right?
I was taken initially to MRI, Manchester Royal Infirmary, which was just around the corner really from where it happened. They waited for some of my family members. My mum's come across from Scarborough, and then it was apparent that they were told that a bed had become available in Hope Hospital, which is now changed its name to Salford Royal Hospital. And that was quite a big thing because they're one of the best neuro units in certainly the area, if not the country. And my mum didn't want me to... Apparently my mum didn't want me to be moved because I was in such a state. She'd apparently come in and my head was massively swollen. I hadn't been cleaned up when she saw me, and they moved me up to the Hope Hospital, and that's where I was in ICU, what's it called, intensive care.
Yeah. And the reason you would have been moved to Salford Royal as it is now is that it's a major trauma centre. So it's one of a few designated major trauma centres in the country that are specially equipped to deal with patients with severe traumatic brain injuries. So you said that you were then in intensive care. Have your family talked to you about the sort of the treatment you were having whilst you were in intensive care and the clinical team around you who was involved?
They mentioned that I had physio when I was in there. They used to, it was obviously quite traumatic for mum to see it. I had physio and they used to sit me up, move me about, just so I didn't get bed sores and stuff like that.
Yeah.
I'm not too sure beyond that.
And I dare say, even if you were conscious, you won't really have much recollection of it.
They used to do something called OBS, which observe, they used to observe you. And they would see if you reacted to pain, and they used to cause pain to me. And mum said it was quite horrible. They used to squeeze my nose and stuff like that. And just see if
test your responses.
Yeah, exactly.
Yeah. And it's important, as you say, with physiotherapy to keep somebody moving, because if they're going to be in a bed for a long period of time, you've mentioned bed sores. There are also things like making sure that somebody doesn't get a chest infection, making sure that they don't have mucus sort of sitting on their lungs for too long. So it's important to keep moving, keep a patient moving.
I had a tracheostomy, actually. I've still got a scar there, which is why I like to wear a V-neck t-shirt in summer to show it off. But
show your war wounds.
Exactly, yeah. Because that's one of the things about brain injury. Somebody with a brain injury can essentially look completely normal. And although I had this massive thing happen to me that put me in a coma for 16 days and put me in hospital for 6 months, and that I've essentially spent the rest of the last 15 years recovering and will do probably the rest of my life. I don't really have many physical scars to show from it. So that's one thing I've got. And mum said they used to clear the pipes, and it used to be quite traumatic for her to listen to.
Yes, I can imagine. And from intensive care, I believe you went to a high dependency unit?
Yeah, it was called, a ward in Salford Royal, it's called HDU. I don't know if that's, the standard throughout all hospitals, but it sounds like it's a high dependency unit, yeah.
And do you know why you were moved there?
I don't know why. Maybe because I'd woken up.
Right.
That's like the first. I mean, I'm not too sure of my facts on that, but I'm guessing because I'd woken up and then it's like the next stage on, get the bed available for someone else, because I was apparently very lucky to get the bed in that hospital. Yeah, I'll give it up for someone else.
Did you move on to a rehab ward after that?
So I moved to another ward in Salford Royal. I think it was called B8, but I suppose that's specific to Salford Royal. And then when my memory picks up is another ward called C2, which I believe in Salford Royal is pretty much the standard route, and that's like the neuro recovery ward. And that's like the last place on the journey in Hope or Salford Royal before you moved on.
And you mentioned before about physiotherapy. Did you have neuropsychology input or occupational therapy?
So I had neuropsychology, but who I still see now, a guy called Russell Sheldrick. He wouldn't see me until I was out of post-traumatic amnesia, because I guess it wouldn't make much difference, because as soon as I had it, I'd have forgotten it again. So he was apparently sat because obviously I used to work in a bar at the time. I was a young student, and obviously at that time you've got a great social life, loads of friends. And I noticed people. My mum said he would sit in the corner of the ward, especially when like all my friends used to come in. And my mum was concerned that he was getting quite upset with the amount of people that were traipsing in and out of this hospital. But he said no. It was a really good thing, because stimulation from the initial stages is really good.
Okay. Well, we'll talk about that in a little while. So you had your neuropsychology. Did you have any other therapies that you can remember?
I remember having physio. One of the reasons I come out so well, I was quite physically fit and strong at the time. And I was a young lad. I worked behind a bar. I was trying to impress people. That's all I was. That's the reason behind that. And one of the things I used to do in the gym beforehand was I used to do like, you know what dips are.
Oh yes, tricep dips.
Yeah. And so in the in like the little gym, there was some like ballet bars, ballet balance bars, and I tried to do some tricep dips on it, and I just got opposite on the floor. So you don't realise how much your strength has disappeared. I remember getting weighed, and my weight had gone down to some. I mean, I was trying to become as big as possible beforehand, and I was like maybe 12 stone, something like that. And I remember it was in kilograms, so I didn't massively understand kilograms at the time. I just remember having this number, and it equated to, I think it was 7 stone 9.
Oh gosh.
And now, I went really, really skinny. So the chance of me, I mean, I didn't have much to lift doing a tricep bit, but the size of my muscles must have just almost disappeared from not moving for so long.
Lost muscle tone.
Yeah.
Which is again why it's important to have that ongoing physiotherapy to try and keep some muscle tone going. Talking a bit more about whilst you were in hospital and this idea of a very fake environment, tell me what you recall of that, and how distorted your reality was.
Well, I think one thing that happens with brain injury is that your initial healing just goes really, you're doing fantastically at first, and you think that, at this rate, I'm going to be back out. I'm going to be back in the pubs in a couple of months. That was my main life. I was a student, so you just think that you're doing really well, and obviously everybody's very encouraging towards you. You're doing really well. No one's going to say you're not doing that well. So you've got this in your head. You're doing fantastic. You're way ahead of the curve, and when you're in the hospital ward, it's a fake environment. So it's like you're told when to get up, when to rest, when to eat, and it's all very structured without you actually knowing about it. You just concentrate on, I think I'm doing great, but
because other people are giving you the structure.
Yeah, as all this thing is set up for you, and you go maybe do some physio, and then you go back and have a rest in your bed, and you see a neuropsychologist, and then you have a rest, and then you're doing lots of resting, and you never do two like physio, you never have like one thing of physio which is quite which is quite physically tiring. You never have that on the morning and then on the afternoon as well. They would never do that. They're spaced out across the week, but you don't realise that.
Yeah.
You just think you're doing great and you're doing fine, and you don't need these doctors and nurses and stuff telling you what to do. You'll be fine on your own, but it's not. So for that reason, it's not the real environment. So if you're ever taken out of that environment, then it would hit you quite hard.
So tell us about when you went to the Trafford Centre, what happened there?
So that was a treat. I kept going on. I wanted a KFC. And as great as our NHS is, their food is awful. So we went to, so as my treat, we went to a restaurant that's still there now. It's in the main dome when you go in. It's called Las Iguanas.
Oh yes.
And we went there, and the plan was to go there. And my sister's boyfriend was driving at the time, Jay, and we just found. I just found it so. When you get seasick, it was, and he was bless him. He was driving as cautiously as he could, and but if I suppose the reason we worked out for is because I'd been still near 3 or 4 months, and I'd not literally moved out of my bed, and then all of a sudden, you got up and you're traveling at 30 miles an hour, you're going around corners, and then you're starting, you're stopping, and I just totally knocked me for 6, and then we were parked with quite a walk to where we needed to go to where the restaurant was. And I remember we came in on the top level, and I remember just feeling really like I got vertigo or something, really disorientated. And we this was my something that I worked out after, that I'd been in this hospital all this time, but then I'd been in a small room. Even the wards were it was no more than 5 meters away, the wall, and all of a sudden I'm in this massive room. And if you've ever been to the Trafford Centre, you've been in that central food hall, and it's basically 100 meters, possibly even more, to the nearest wall. And I just think you're coming from one place you've never moved, with the walls 5 meters away, and then you go to a place for 30 miles an hour and around different corners, and then you all of a sudden you're in this massive room
with lots of people,
presumably. With lots of people, yeah. And it's just everybody in the hospital, I kind of knew the name. Well, obviously I kept forgetting them because I had a brain injury, but I knew most of them. Most of them were nurses, and you were used to seeing the same people. That's what I mean. And then all of a sudden there was lots of different people.
Lots of noise and light.
Yeah. We chose a specific day that was quite quiet. I think we went on a Tuesday night or something like that, just so it wouldn't be that busy. But it was still a lot busier than I'd ever been used to before for the last 5 months anyway. So it was quite a traumatic experience. It was my first. You sit there. What happens is you sat in your bed and you're just imagining how your life would be. You get into nightclubs and you're going to do this and you're going to do that, and but you don't know anything about how much the noise would affect you, how much the lighting would affect you, how much the music or other people. It's just you don't take any of that into account. So it's when it hits you, it hits you quite hard.
Yeah. And did that make you realise that actually perhaps you weren't ready for the big wide world just yet? I don't think I had this attitude that I was that I was okay. And then maybe I was a bit ashamed that I'd been telling everyone I was okay. And then when the opportunity presented itself, that I really wasn't okay, but I didn't want to admit that. So even to myself as well, I just made my own excuses in my head, and I
I don't know. It was just I think it was put it down to a bad day at the office.
Yeah, I mean, I guess it touches on the issue of what we call insight and understanding, having that full understanding of
Big time,
where you are versus where you think you are. Yeah. It's often seen with people with brain injuries that they don't necessarily have full insight, that they do think they're doing better than they are, or as you know, as we've discussed, that you're in a fake environment in hospital where you have a structure and routine in place for you anyway. But when you're in the real world, if you like, those things aren't necessarily there, and it's quite an adjustment. Thinking also about when you were in hospital, you've got some stories, haven't you, about some of the dreams and the confusion that you had. Talk to us about some of those.
That was post-traumatic amnesia. So I guess by nature of the name, a lot of them I can't remember. So I was in this state of post-traumatic amnesia for 6 weeks. We worked out. And I can probably remember 1 or 2 nights of it. My mum and my sister had come in one morning. Again, another trauma that I've introduced them to. When they came in, I was like very sort of, full of bad language and stuff. And I was pointing to this nurse that had been there. And I'd accused him of all sorts of stuff and accused him of kidnapping me. And what I'd said... And I still, do you know what? It's bizarre because I've still got this memory of this actually happening. I just know that it was not a real memory, and it's, I know that it's a real memory and that I've made it up, but I still have the memory of it happening. I remember being sat on a train, like there's every so often there's there's normal seats and there's a table, isn't there? So I was sat on a table, and I remember this guy had a gun up at the bottom of the table pointing towards me, and I was being kidnapped. But I suppose you don't really fill these stories in when your brain's not working properly. Like, why was I being kidnapped? I have no idea. It doesn't make any sense, and I don't think I thought to ask. I was just being kidnapped, and it was a woman. The woman pushing the trolley was the healthcare assistant. That used to work in the, it's a bit of a coincidence as well. Why didn't I work that out? I don't know. But, and then the guy accused of kidnapping me was actually the nurse who was what they called special in me, who was like, he was sat by my bedside all night. So this poor guy had sat by my bedside for his entire shift, and I've thanked him by accused him of kidnapping me. That was the first one I can remember. The second one's perhaps a little bit funnier. So I spoke to this nurse called Aaron, and I still want to go back, because apparently he's still working there. So I still want to meet him. And I asked him where my slippers were, because I was always losing stuff, even though it's just around my bed. I asked him if he'd seen my slippers, and I told him I think I'd left them in the state restaurant, which obviously confused him, and because there's a canteen, hospital canteen, that's all it was. And I don't think there was a state restaurant. Nobody told me about it anyway in Hope Hospital. And I told him that it was on the roof, and I've still got this genuine memory of this happening to me. And I'd gone up on this roof where there was a field of cows, and it was a bit like when you go in a seafood restaurant, you choose the fish you're going to eat out of the tank. It was a bit like that. You chose the cow that you wanted to eat, and I thought this was in the hospital.
Yeah.
And if you sit and think about it, that's just so easy to disprove, because that would mean they would have had to, in a sterile environment, which is a hospital, lead a load of cows up in the lift to up to the roof, which was on the in the elevator, which was on the roof, and but with a brain that's been in shock, you just don't think about anything like that.
Yeah. Well, yes. I think that's a great example of what we call confabulation, where you have these weird and fantastical memories that feel very real, but are obviously not real when you sit and rationalize them, but they sort of fill in the gaps of other real memories. So a bit like the dream with the nurse kidnapping you, you know, you'd got real memories of the nurse who was sitting by your bed and the healthcare assistant. They featured in your dream, but then your brain, I guess, in its way of repairing itself, it's then reaching for other memories that don't really exist.
Maybe that had come from a film or something that I'd seen. I don't know,
yeah, and just sort of joining up the dots, but in the wrong way.
Yeah, hugely the wrong way.
Very much so. Unless Salford Royal's got a steak restaurant on the roof now, I don't know. But it's very interesting, and I think it goes to show how brain injury can affect people in so many different ways.
So many different ways, yeah.
During your recovery, it's and I think it's important to note that recovery is different for everybody. So what might have happened to you as part of your recovery process won't necessarily be the same for the next person, because everybody's different.
It's an absolute, like a lottery, isn't it? It's just, there's so many different factors, so many different types of the different parts of the brain that do different things, and you know, even if you're never going to injure the same cells as that same person, and even so, even if you do injure the same cells, they've got a different brain, so it will have different effects on them. Yeah,
absolutely. And you know, we've mentioned how you were a young man, you were a very fit and healthy young man, and that, of course, might have changed the outcome for you as opposed to somebody else who perhaps wasn't at the same age or same level of health. So it's very different. And that leads us quite nicely to thinking about tips for friends and family members when their loved one is in hospital. So you mentioned about early stimulation. I think it's important as well, though, not to overwhelm somebody so that there's too much stimulation. And, you know, we saw that with your trip to the Trafford Centre, that was perhaps a bit too overwhelming. It's finding the right balance. But in what ways do you think friends and family could stimulate their loved one in hospital?
I suppose one thing there was like in the hospital I was in, there become this culture of like who was doing the best and who was recovering the best, and you can I guess with the family and stuff could happen as well. They could like overstimulate, you know, over push them, I guess. What you've got to do is you've got to take the advice of the doctors and take it very seriously.
Absolutely. I think those discussions with the treating team about how a family member or friend can help, what they can do, and making sure that they're working in tandem with the clinical team so they're not upsetting the routine and the structure. Yeah,
you can do too much, I think, but you can do too little as well. I think pictures, my family brought in different pictures, you know, anything from their old life, because the hospital is it's a horrible, you know, very clinical environment. It's green, it's grey, and it's not very nice. So anything that you can bring from home, anything that can familiarise them with it.
So perhaps music as well, if they brought in an MP3 or an iPod.
Yeah. Don't bring a ghetto blaster. That won't go down very well. But my dad brought me like an MP3 and mixed like a shuffle, and just with loads of my favourite songs on it, and put it in my ears. They used to do that when I was in a coma. Actually, they used to put the shuffle in my ears. Just let me listen to them.
Just to try and stimulate something. I guess also talking to somebody whilst they're in hospital, just talking about anything really, talking about things that have happened in the past, or
I would say don't get too stressed if the person repeats themselves. That's what's going to happen a lot, especially in your post-traumatic amnesia.
I guess also you mentioned pictures, perhaps bringing in things for them to read or reading to them.
When I was in hospital, I was reading, and I was shutting one eye, and you know, I didn't really realise why I was shutting one eye. I was just doing it because it was easier, but that's because I had double vision. I mean, obviously it was a lot worse then. It's got a lot better now, but I've still got it now. And I still do it now, shut one eye. That's why I can't read.
I suppose if friends and family members that are visiting notice things like that, then feeding that back to the clinical team.
Yeah.
I suppose coming back to other tips and advice for friends and family, certainly to liaise with the clinical team and ask them what they can do to help, how they can help. We talked before about not overwhelming someone too much. So another thing could be that somebody takes responsibility for organising who's visiting when, so that you don't have all
Too
your
many
friends.
people, yeah. Which I did on a couple of occasions, yeah. That was just the one set of friends, they came in from the bar and...
Not from the bar.
Not from the bar, after a couple of Stellas that came along to see Brooke. But it was, they all come at once, but they were one group of friends. So it wasn't like, I was like having several different groups.
Mm-hmm. Yeah. I guess also it's important though not to overwhelm, because people can find that they have difficulties following more than one person if there are lots of people speaking at once.
I still get that now, yeah. Get that now 15 years later. I suppose the perfect environment for me would be a coffee shop on a Tuesday afternoon, but it's not very rock and roll, is it? It's not really what you want to become. And something that's happened to me as well is that I still want to. So from when I had the injury, I was chasing to get back to the person I was, and in a sense still am, but that person is 24 years old and I'm now 38, so I've lost a bit of it's just been a whole weird thing for me. It's like I think I've lost out on a lot of that period of when you become into an adult. I was just on the, I mean, I'd done things. I'd been to Australia, I'd been, I'd moved away from home, I'd been to uni, and but I haven't a lot of the mundane things like buying a house, getting your first job, finishing uni. I never got to do that, so I missed out on that.
Yeah, sort of typical life milestones.
Yeah, I think that was the time when you become from being a teenager into an adult. I kind of missed that. I had the period of my life was different to everyone else's. So yeah, I don't have that much.
And it's a significant adjustment. As you say, you were chasing who you were, but who you became after the injury was kind of a new you.
Yeah.
And it's important that people realise that, family, friends, anyone really, that after an injury, it's very difficult for that person to return to exactly how they were. There will be a change. Coming back to some other tips as well, and I guess this is for our audience generally, asking to be involved in meetings with the clinical team, so that they know what the direction of travel is in relation to care and rehabilitation, and that they can have some input as well, because as the people closest to the injured person, they know that person really well, and that can help to inform the clinical team about how somebody might improve or might react or benefit to a course of action. There are also various external sources of support. Headway is a particular source of support. Headway is a charity a national charity that supports survivors of brain injury, but also their friends, their families, their carers, and they have a wealth of information on their website and fact sheets about what people can do and the resources that they can turn to. There are also other charities and organisations like the Brain Injury Group. There may be more local community organisations. Headway also runs a HATS nurse scheme, and again, the HATS nurse in the hospital might be able to provide some specific support. So there are various things that friends and family can do and can turn to in order to support their loved one, but also for themselves in terms of understanding what's going on, and understanding how they feel about it, as well, because we know that brain injuries, it's a huge adjustment. We've talked about, not going back to the old you, which is a big adjustment for you, but it's equally a big adjustment for everyone else who knew you as you were and are coming to terms with you as you are now.
It's like a grieving process. You're grieving for that person, because that person's gone, even though they're physically still there, and they largely look the same. Essentially, they're not the same person. The brain inside the head has changed, so they're essentially a different person.
Yeah, it's the new you.
Yeah, and it's about being positive about that and not being hung up on the the old you, because you're never going to achieve that. So there's very little point in trying to in mourning over that. And there's a thing in what was Hope Hospital in Salford Royal, and it's probably still there now. It's in Salford Royal Hospital in the neuropsychology department. There's a big a mural on the wall, and it says, "Don't look back. You're not going that way." And it's something that something I've come to realise how correct that is later in my recovery, because there's no point looking back. You're going forward, and you need to concentrate on the person that you can become now.
I think that's a really positive message. Thank you for sharing your experiences, Brooke. That was really, really helpful, and I'm sure our listeners would agree. Join us next time when we'll be talking about fatigue and the importance of rest and tips around managing fatigue. Make sure you check out the footnotes for more help, advice, and resources.